Thank you very much. Good afternoon, and thanks to the organizing committee for letting me share my results on our study in this beautiful theater. We all know that post-vitrectomy CME is common and it will delay visual recovery, but it's usually self-limiting, and the inflammation, post-inflammatory, post-operative inflammation is usually an important risk factor. The problem is when it persists, it's usually quite hard to get rid of it. We were interested in the factors that are related to the persistent CME after vitrectomy for rhegmatogenous retinal detachment. Our inclusion criteria were primary rhegmatogenous retinal detachment after post-Plana vitrectomy with at least 6 months of persistent CME despite treatment. We had 15 eyes in the study group. We matched them with age, gender, type of surgery. We matched them with 70 control eyes, and we analyzed both pre, peri, and post-operative factors, first in univariate and afterwards in multivariate regression model. This is just a drawing, multiple drawings of the preoperative status of the CME group, just to give you an impression what the tears were like, and I just lifted out a few details for the sake of time. These are the two groups. You can see that they're quite comparable, even if you look at the patients that had silicone oil. The duration of the silicone oil was not significantly different. And these are the most important things that we analyzed based on our theoretical knowledge and our own experience, and we've analyzed even more than this. And after a multivariate analysis, there were 3 that came out to be significantly correlated with persistent CME. Those were multiple tears, the type of tamponade, and giant tears. Here's the table depicting the p-values, and you can see that it's multiple tears, giant tears, and silicone oil 1,000 centistokes, not 5,000. That's correlated with significantly correlated with persistent CME. Of course, this is a retrospective study, but the correlation is quite significant. And I think we can say that giant tears, multiple tears, and the use of silicone oil 1,000 are correlated to persistent postoperative CME. The extent of inflammation is an important factor, we know, and the blood-ocular barrier, especially in larger tears, combining this with kind of pro-inflammatory silicone oil in the eye may cause these problems. And we all know that silicone oil 1,000 shows more inflammation and shows more emulsification, which is related. And the role of steroids is something that can be talked about later. And the take-home message is this: you should use silicone oil 5,000 instead of 1,000 centistokes, and especially in cases with multiple or giant retinal tears. I'd like to thank you very much.
Do you correlate, I mean, obviously the number of breaks and the giant retinal tears, they need more laser. Mm-hmm. I mean, could you relay that, the more laser, and correlate that with the cystoid macular edema? Because you do obviously much more laser in these patients. The other thing is, I mean, the 5,000, you're doing 23 gauge, yes?
23, 25, yeah.
Yeah, I mean, getting the 5,000 centistokes in 23 gauge is so much time consuming. And the other question, how long do you leave the silicone oil? A month, 3 months, 6 months?
Okay. To start with the first question, we did not quantify the amount of laser, but we do 360 laser in all cases, so there'd be a bit of a difference, but not much. The other question about the centistokes is, it's grown when I did 20 gauge surgery. I kind of got annoyed by the emulsification and patients complaining about the emulsification of silicone oil 1,000. So that's when I switched. That was when I switched to 5,000, and then I kind of forgot the problems. Then I got to 23 gauge and thought, this is so slow. Why not go back to 1,000? And then I saw the problems coming back again with the emulsification. So I switched back to 5,000. And coming to your last question, yeah, it's slow. It is. The injection is not very much slower than 1,000. And for the removal, I use a 23 gauge cannula instead of a 25. The rest I do 25 now. And yeah, it gives me about 9 or 10 minutes to think about other things in life.
Thank you.